Ever wondered why, after a delightful meal, you suddenly feel like there's a fire in your chest? This uncomfortable, burning sensation right behind the breastbone is what many refer to as heartburn. It's a common experience, affecting millions worldwide, and it doesn't discriminate by age or lifestyle. In this video, we'll explore the causes, effects, and various ways to manage heartburn. From dietary choices to lifestyle changes, understanding heartburn is the first step toward relief. Stay tuned as we unravel the mystery behind this fiery sensation. First off, what is this fiery foe we call heartburn? Heartburn, or what doctors refer to as gastroesophageal reflux disease, GERD for short, is not as directly related to the heart as the name might suggest. Instead, it involves the digestive system, specifically the esophagus, which is the tube that connects your mouth to your stomach. Here's what happens. Normally, when you eat, food travels down the esophagus, and a muscle at the end of it, called the lower esophageal sphincter, automatically closes, preventing stomach contents from coming back up. However, in cases of heartburn, this muscle doesn't close all the way or opens too often, allowing acid from the stomach to rise back up into the esophagus. This results in a discomforting sensation often described as a burning feeling in the chest. It's crucial to clear up a common misconception here. Despite its name, heartburn has nothing to do with the heart. It's entirely a gastrointestinal issue. Now that we know what heartburn is, let's explore what sparks this unpleasant experience. Think back to your last episode of heartburn. What had you eaten? Chances are it might have been one of the usual suspects known to trigger this fiery foe. Let's delve into the world of culinary culprits and understand why certain foods can turn our meals into a less than comfortable experience. Starting with spicy foods, these flavorful delights are a common trigger. The capsaicin in peppers, which gives them their heat, can irritate the lining of the esophagus. This irritation can lead to that burning sensation we know all too well as heartburn. Citrus fruits, while packed with vitamin C and flavor, are naturally acidic. Oranges, lemons, and grapefruits can exacerbate symptoms of acid reflux by increasing stomach acidity. It's not just the fruits themselves, but also products made from them, like juices, that can lead to discomfort. Then there's chocolate, a favorite treat for many. Surprisingly, it's not just about the sugar. Chocolate contains both caffeine and a compound called theobromine, which are found in the cocoa bean. These compounds can relax the lower esophageal sphincter, the valve that keeps stomach content from moving backward, thus allowing stomach acids to escape up into the esophagus. Speaking of caffeine, let's talk about caffeinated beverages, including coffee and some teas. Caffeine is a known trigger for heartburn because it can cause the lower esophageal sphincter to relax, similar to chocolate. This relaxation allows acid to reflux into the esophagus more easily, causing that uncomfortable burning sensation. Lastly, fatty foods are notorious for their role in inducing heartburn. Foods high in fat slow down the stomach's emptying process, which can increase the likelihood of acid reflux. This is why meals heavy in oils, butter, and cream can often lead to symptoms. Understanding these dietary triggers is crucial in managing heartburn. Each person may react differently to various foods, so paying attention to how your body responds after meals can help in identifying your personal triggers. Diet plays a huge role, but it's not the only factor. Let's dig deeper. Aside from what we eat, how we live can light the fuse for heartburn. It's not just about the spicy taco or the citrusy drink. Our daily habits play a pivotal role in stoking the flames of this discomfort. Take smoking, for instance. It's like throwing gasoline on the fire. Smoking relaxes the lower esophageal sphincter, that crucial barrier preventing stomach acids from backing up into the esophagus. This not only triggers heartburn, but can exacerbate existing conditions. Then there's alcohol. Enjoying a glass of wine might seem harmless, but alcohol can increase stomach acid production and relax the esophageal sphincter, both of which are recipes for a heartburn flare-up. And what about our eating habits? Consuming large meals can overwhelm our stomach, forcing acid up into the esophagus, especially if we lie down shortly after eating. This is why those late-night snacks can turn into a midnight ordeal. Physical activity, or the lack thereof, also weighs heavily on our digestive health. Regular movement helps keep the digestive system running smoothly, decreasing the likelihood of acid reflux. On the flip side, a sedentary lifestyle can slow digestion and pressure the stomach, escalating the risk of heartburn. Stress, the silent aggravator, also deserves mention. It doesn't just wreak havoc on our mental health, it can lead to poor digestive health. High stress levels often correlate with increased acid production, which can lead to, you guessed it, more heartburn. Adjusting our lifestyle choices can turn down the heat, but how can we actively combat heartburn? Now, how do we quench this fiery ordeal? Well, managing heartburn effectively requires a blend of lifestyle adjustments and, when necessary, the judicious use of medications. Let's explore some practical strategies to keep heartburn under control. Firstly, consider the size and frequency of your meals. Eating smaller, more frequent meals rather than 2 or 3 large ones can significantly reduce the pressure on your stomach. This means less likelihood of stomach acid being pushed back up into your esophagus, which is the primary cause of that uncomfortable burning sensation. Another key strategy is to identify and avoid foods that trigger your heartburn. Common culprits include spicy dishes, citrus fruits, chocolate, and caffeinated beverages. But remember, triggers can vary widely from person to person. Keeping a food diary can be an incredibly useful tool in identifying which foods set off your symptoms. Once you know your triggers, steering clear of them can help prevent the onset of heartburn. It's also advisable not to lie down immediately after eating. Give your body at least 3 hours to digest the food while you're upright. This position helps keep the stomach acids where they belong, in the stomach. If heartburn tends to strike at night, consider elevating the head of your bed. A slight incline can prevent acid from traveling back up the esophagus while you sleep. For many, over-the-counter antacids provide quick relief by neutralizing stomach acid. However, these should be used sparingly. If you find yourself reaching for antacids frequently, it might be time to discuss stronger medications or other treatments with your healthcare provider. Options like H2 blockers or proton pump inhibitors can be more effective for managing chronic heartburn. Lastly, don't underestimate the power of a healthy lifestyle. Regular exercise and maintaining a healthy weight can significantly reduce the frequency and severity of heartburn episodes. Implementing these strategies can help keep the flames at bay. By adjusting how and what you eat and taking care when symptoms arise, you can manage heartburn effectively and lead a more comfortable life. Sometimes the fire burns out of control and it's time to call in the professionals. Heartburn can often be managed with lifestyle changes and over-the-counter remedies, but there are times when it's crucial to seek medical intervention. Recognizing the signs that indicate a more serious condition is key to preventing complications. If experiencing chest pain that feels like an enormous weight is bearing down, it could be a sign of a heart attack or severe heartburn. Difficulty swallowing or feeling as if food is stuck in the throat may suggest an esophageal obstruction or severe inflammation. Frequent heartburn symptoms that persist despite the use of over-the-counter antacids are also a red flag. This could indicate gastroesophageal reflux disease, or GERD, which requires professional treatment to manage effectively. Moreover, if there is vomiting with blood or stool that is black and tar-like, immediate medical attention is necessary, as these symptoms can indicate bleeding in the gastrointestinal tract. Never ignore persistent or severe symptoms. Always consult a healthcare professional. Let's do a quick recap of what we've covered about battling the burn of heartburn. Heartburn isn't just a minor inconvenience. It's a common symptom where stomach acid flows back up into the esophagus, causing that all-too-familiar burning sensation. Recognizing this is crucial in addressing the issue effectively. We've identified various triggers, from the foods we eat, like spicy dishes and citrus fruits, to the timing of meals. It's interesting how even a simple act of lying down right after eating can escalate the symptoms. Lifestyle modifications play a pivotal role too. Small changes such as eating smaller, more frequent meals and managing stress can significantly alleviate heartburn symptoms. It's about creating a balanced environment in which your body can thrive without discomfort. We also discussed management techniques, including over-the-counter remedies and natural approaches like ginger tea or alkaline water. Knowing when these aren't enough and it's time to seek medical help is vital for your health. Thank you for joining me at the Knowhow Hub. Remember, understanding your body is the first step to better health. Until next time, stay informed and stay healthy.